Hello, and welcome to UMCC Medical Consultant Connectors. It is a pleasure to have you with us today as we explore important health topics that affect you and your family. Your well-being is our top priority. Clear, accessible information is the first step toward making empowered health decisions. We break down complex medical subjects into understandable insights. Our goal is to equip you with the knowledge you need to navigate health with confidence. We are so glad you have joined our community, a place where curiosity meets clarity, where your health questions find answers. Before we dive in, I want to ask for your support. If you find this valuable, please consider liking this video, subscribing to our channel, sharing it with friends and loved ones. Every like, share, and subscription helps us grow our community and reach more people who can benefit from this information. By doing so, you are not just supporting us. You are helping to spread awareness and build a more health-literate society. Your engagement lets us keep bringing expert medical knowledge to you, free of charge. Today, we are talking about a serious respiratory infection known as pertussis, or as it's more commonly called, whooping cough. You may have heard it called the 100-day cough. This illness can linger for weeks or even months, causing severe coughing fits. It is an ancient disease that remains a modern threat, especially to the most vulnerable among us, infants, young children. Understanding pertussis is crucial because while it might start like a common cold, it can escalate into a life-threatening condition. Know what it is, how it spreads, how to recognize it, your first line of defense. The importance of this topic cannot be overstated. Whooping cough is not just a bad cough. It's a highly contagious bacterial infection that can lead to serious complications like pneumonia, seizures, brain damage, even death. This is especially true for babies too young to be fully vaccinated. Outbreaks still occur, even in communities with high vaccination rates, which is why continued vigilance and education are essential. By learning about pertussis today, you are taking a proactive step to protect your health and the health of those around you, especially the youngest and most fragile members of our communities. So, what exactly causes whooping cough? The culprit is a tiny bacterium called Bordetella pertussis. These bacteria are incredibly effective at what they do. Once they enter your respiratory system, they attach to the cilia. These cilia are the tiny hair-like extensions that line the upper part of your respiratory tract, responsible for sweeping out mucus and debris. When the pertussis bacteria attach to them, they release toxins that paralyze the cilia and cause inflammation and swelling in your airways. This damage leads to the severe, uncontrollable coughing fits. It's a direct assault on your body's natural defense mechanisms. The spread is remarkably efficient. The bacteria travel in tiny droplets released when an infected person coughs or sneezes. Breathing them in can infect you. It can also spread by touching a surface with droplets, and then touching your face, your nose, your mouth. People are most contagious early, about 2 weeks after the cough begins, sometimes before they realize it is more than a cold. Doctors describe 3 stages of pertussis. First, the catarrhal stage lasts 1 to 2 weeks and looks like a common cold. Runny nose, low-grade fever, mild occasional cough, and sometimes apnea in infants. It is highly contagious and often spreads because people think it is harmless and continue daily routines. Then the paroxysmal stage, lasting 1 to 6 weeks, sometimes up to 10, with violent, uncontrollable coughing fits that leave you breathless and may cause the high-pitched whoop, especially in children. Recognizing the signs and symptoms of pertussis is critical for early intervention. It starts so subtly. In the beginning, runny nose, sneezing, a mild cough, much like a regular cold. You might also have a low fever. After a week or two, the nature of the cough changes dramatically. It evolves into severe hacking coughing fits that can happen again and often end with a distinctive whoop as you gasp for air. Not everyone whoops. This sound is more common in children than in infants or adults. Coughing can be so violent it causes vomiting and profound fatigue. Infants may not cough much. They can struggle to breathe or have apnea and may turn blue or purple from lack of oxygen, cyanosis. At the doctor, expect a thorough history about symptoms and exposure, followed by a physical exam. A nasopharyngeal swab is the most common and accurate test. Briefly uncomfortable, but quick and essential. Culture can take time but is definitive. PCR is faster and more sensitive, detecting bacterial genetic material. Blood tests may check for signs of infection like a high white blood cell count, the immune system at work. Samples are sent to the lab for analysis to confirm the diagnosis. Once a diagnosis of pertussis is confirmed, treatment should begin as soon as possible. The primary treatment is a course of antibiotics. They reduce contagiousness and can shorten how long you are sick. Common antibiotics include Azithromycin, Clarithromycin, and Erythromycin. Take the full course exactly as prescribed, even if you feel better. Stopping early can let the infection persist and risk others. Early treatment is key. Antibiotics work best in the first 1 to 2 weeks before severe coughing starts. If started later, antibiotics might not shorten illness but still help prevent spread to others. Close contacts, such as household family members, may be given preventive antibiotics to protect vulnerable people. Severe cases, especially infants and young children, may need hospitalization for close monitoring and supportive care. Care may include suctioning airways to clear mucus, administering oxygen for breathing trouble, and providing intravenous fluids to prevent dehydration. Babies are monitored for apnea or distress. Hospitals offer immediate action if complications arise. Antibiotics attack the bacteria but do not instantly stop the cough. Airways need time to heal. At home, rest, drink plenty of fluids, use a cool mist vaporizer, and avoid irritants like smoke, dust, and chemical fumes. Be patient. The cough can linger for weeks. Without a doubt, the most effective tool we have for preventing whooping cough is vaccination. There are 2 main vaccines used in the United States, Tdap for children and Tdap for adolescents and adults. Tdap protects against diphtheria, tetanus, pertussis. Tdap is given in 5 shots, at 2, 4, 6 months, between 15 and 18 months, and a final dose between 4 and 6 years old. Immunity wanes over time. That is why boosters matter. Tdap is recommended at 11 or 12 years. Adults who missed it should get 1 Tdap shot. Pregnant women should get Tdap each pregnancy, preferably between 27 and 36 weeks, to transfer protective antibodies and guard newborns. Beyond vaccination, practice good hygiene. Cover your mouth and nose with a tissue or your upper sleeve. Do not cough into your hands. Wash hands with soap and water for at least 20 seconds, or use alcohol-based sanitizer. Small habits make a big difference. If a persistent cough develops or you suspect whooping cough, seek medical help right away. In closing, thank you for joining us at UMCC Medical Consultant Connectors. We hope this has been informative and empowering. Remember, good health starts with good information. Stay safe, stay informed, and be well.